there are a couple of new and emerging treatments as well, right? What are those?
Yeah, so right. So I'm really proud to report to the viewers that just now in real time, just in the last year, really, we have several major developments. And now these are not yet FDA approved agents. They're experimental investigational agents, but they've reached what's called phase 2 or phase 3 testing, which is the later stages of testing. I'd like to highlight 4 or 5 of those. These are mostly in the combination space. So this is a JAK inhibitor plus the new agent. One is called navitoclax. That's a BCL-XL inhibitor, not yet FDA approved for any indication, but this has been shown to have activity in the phase 1, 2 trials, either as a single agent or in combination, and now that's reached phase 3 testing. The second one is the pelabresib agent, which is bromodomain or BET inhibitor. A third, if you can believe it, is selinexor, which is an XPO1 inhibitor. And a fourth, really now entering into phase 3 trials, is the MDM2 inhibitor navtemadlin. You have these 4 drugs which are either completing or starting phase 3, which is the most advanced testing. That means they're randomized trials, usually international trials, many hundreds of patients. It's an amazing effort that's unprecedented. And by the way, these are being tested in the frontline setting before patients have ever had a JAK inhibitor in combination with. Beyond that, Catherine, there's many, many trials with novel agents by themselves. So imetelstat comes to mind, which is a telomerase inhibitor, for example, which is also in the phase 3 testing in the relapse setting. So you've already had a JAK inhibitor, it didn't work out for you. And interestingly, in that trial, the overall survival is the primary endpoint rather than spleen and symptoms, which marks the first time we've ever seen that. It also marks the understanding that these chronic diseases, chronic myelofibrosis, can then turn into a more advanced acute in the relapse setting. So that's just a sample of some of the ones that are now entering the late stages of trials, many more in phase 1 and 2. In a good way, there's a new trial opening once a week.